Hello everyone. Today we are going to discuss the LINERS and MCQs in relation to pediatrics. These MCQs we have already discussed in separate videos, but today this I have just collected all these for quick revision from MCQ 1 to 50. To start with, thyroxine hormone gets secreted in the fetus from which weeks of gestation? Answer is 12 weeks. Second, which period in the prenatal life is known as embryo? As we know, there are several stages, just like fetus, embryo, infancy, many terms are there. So which period in the prenatal life is known as embryo? The answer is, it is the day 14 to 9 weeks of gestation, that is known as embryo. Then about the other terminology like your ovum, day 0 to day 14 is known as ovum. Embryo is your day 14 to 9 weeks. Fetus is your 9 weeks to birth. Perinatal period is 28 weeks of gestation to day 7 of postnatal life. This period is known as perinatal period. Then what do we mean by extended perinatal period? That is from 22 weeks of gestation to day 7 of life. Perinatal period is 28 weeks, but extended perinatal period is 22 weeks. Why it is so? Because as we know, health infrastructure is developing day by day. So previously, after 20 weeks of gestation, if a baby is born, then we can able to survive that child. But now, even at 22 weeks, if a baby is delivered, he can lead a normal life with this advanced medical infrastructure. That's why they have extended the perinatal period from 28 weeks of gestation to 22 weeks of gestation. So extended perinatal period is your 22 weeks of gestation to day 7 of life. Similarly, neonatal period is day 0 to day 28 of life. It is not 1 month. It is 28 days of life from birth to 28 days of life. That is known as your neonate. Similarly, young infancy. Infancy is your first year of life. But young infancy, it is often asked in the exam. Young infancy, it is the first 2 months of life of infancy is known as young infancy. These are the terminologies we have to remember. Next, 90% of the adult head size achieved by what age? Answer is 2 years. At birth, your head size is 65 to 70% of adult head size. It increases gradually. First 3 months, it increases by 2 cm per month. Then it increases by 1 cm per month from 3 months to 6 months. Then it increases by 0.5 cm per month from 6 months to 1 year. So, initial 3 months, 2 cm per month, then 2, 2, 2, 1, 1, 1, then 0.5, 0.5, 0.5 till 1 year. This we can remember by this. So, by 2 years, your 90% of the head size will be achieved. Birth weight get doubled by what age? The answer is 5 completed months. Suppose the baby weight is 3 kg, the baby will achieve a weight of 6 kg by the end of 5 months. So, by the end of 5 completed months, the birth weight will be doubled. Similarly, question may be asked, by 1 year, the birth weight will be tripled. Quadruple 4 times by the end of 2 years. Next, birth length. We have discussed about weight. What about birth length? Get doubled by what age? The answer is 4.5 years. As you know, at birth, the length is 50 centimeter. It increased by half in the first year. So, first year 50 plus 50 by 2, that is 25 centimeters. Total is 75 centimeter by the end of 1 year. Similarly, second year, again, another 25 by 2. Another 12.5 centimeter, the length will be increased in the second year. So, by the end of second year, the length would be around 80, 85 to 90 centimeter. Then when the birth length will be achieved, a height of 1 meter or doubling of the birth length, it will be achieved by the age of 4.5 years. Another question, when the birth length gets tripled, that is another MCQ. Doubled by the age of 4.5 years, then when the birth length will be tripled, it will be by the age of 12 years. Then height of the children in the period of 2 to 10 years is increases by 6 cm per year. This we can remember. Next, head circumference of an infant increases by what centimeter during the first 3 months. This we have discussed. First 3 months 2 cm per month, 2 2 2. Second 3 months 1 1 1. Last 6 months 0.5 every month, 0.5 centimeter every month. This we have to remember. Next, at what age do first permanent teeth appear? First permanent teeth, it will appear by the age of 6 years. First permanent teeth to erupt is your first molar, around 6 to 7 years. Similarly, first primary teeth to erupt is your lower central incisor by the age of 5 to 8 months. Then one question may be asked, what are the causes of delayed dentition? Delayed dentition causes are, first is your hypothyroidism, second hypopituitarism, third rickets, and another cause could be congenital syphilis. So these are the things we have to remember. If one child is having no dentition by the age of 13 months, then we have to think the possibilities could be either could be hypothyroidism or hypopituitarism or rickets or congenital syphilis. Next, microcephaly. What do you mean by microcephaly? Your head circumference below how many standard deviation? This we have to remember. Is it 2 or 3? To say microcephaly, your head circumference should be less than 3 standard deviation. But macrocephaly is more than 2. When the head circumference is more than 2 standard deviation than the age, then we can say it is macrocephaly. But for microcephaly, it is less than 3 standard deviation. Someone may ask, why is it so? Why microcephaly is less than 3 but macrocephaly is more than 2? Because microcephaly we cannot do anything. What is done is done. So we cannot change. But macrocephaly, if you can detect early, so there are some reversible causes, some preventable causes. So if you can detect early, you can treat the cause, then macrocephaly can be prevented. That's why for the early detection of macrocephaly, they have kept the bar at the 2 standard deviation level. But microcephaly, it is less than 3 standard deviation. Causes of microcephaly, it could be familiar. Some syndromes like your Down, Edward, Cre-Du-Chat or torch infection, we can get microcephaly. Which amino acid known as nature's sleeping pill? This one is interesting MCQ. The answer is tryptophan. Tryptophan is the precursor of serotonin and it is also called provitamin B3 as it is the precursor of niacin also. So nature's sleeping pill is your tryptophan. Next, wheat lacks which amino acids? As you know, pulses and cereals, wheat lacks which amino acids? The answer is lysine and theanine. Your cereal lacks lysine, your pulses lack methionine. This cereal lack lysine. This we have to remember. And pulses lack methionine. Next, from which day of life a eyesore baby will start gaining weight? The answer is day 2. Because normally in term or preterm babies, there is one term called physiological weight loss. It is universal with all children during the first week of life. But in eyesore babies, they have lost their weight in utero. So there should not be any further weight loss after birth. So one eyesore baby should start gaining weight by day 2 of life. If one eyesore baby is born and you are observing weight loss day by day, then you have to think of some other causes like your sepsis, hypothermia or something like that. Next, Wilson's disease occurs due to defect in which gene? Answer is ATP7B. Something about Wilson's disease. It is an autosomal recessive inheritance. Chromosome number is 13. There are several manifestations: hepatic, neurologic and hematologic. Hepatic, it could be hepatitis due to hepatic failure. You can get K ring in 50% of cases. Wilson disease, because in hepatic manifestation, then K ring you can get 50% cases. But in neurological manifestation, we will get K ring around 95 to 100% cases. Neurological manifestation could be tremor, dystonia, psychiatric manifestation. Hematologically, we can get Coombs negative hemolytic anemia. This we have to remember. Then your treatment, your investigation says your penicillamine challenge test and liver biopsy. And treatment could be penicillamine, your trientine and zinc. Next, which hormone is responsible for milk secretion reflex? Two terminologies are there. One is milk secretion reflex, another is milk ejection reflex. Which hormone is responsible for milk secretion reflex? The answer is prolactin. Prolactin, it is produced from the anterior pituitary. It is mostly secreted at night. Oxytocin is responsible for your milk ejection reflex. Milk ejection reflex hormone responsible is oxytocin secreted from posterior pituitary. Your sucking as well as thought, sight, sound of the baby will produce oxytocin. That's why it is affected by emotion of the mother. But prolactin, it do secreted in the night. So we have to promote night feeding for secretion of your prolactin. Next, Sonnat and Sonnat staging is used to classify which disease. This is a very simple question. Answer is HIE, hypoxic ischemic encephalopathy. As you know, it is divided stage 1, 2 and 3. Other stagings used for HIE are your Levin staging and your Thompson scoring. BCG catch-up vaccination can be given within what age as per NIS or National Immunization Schedule? The answer is 1 year. But as per IAP, BCG can be given up to 5 years. Similarly, some other catch-up vaccination, hepatitis B catch-up vaccination, if somebody has missed the vaccination opportunity at any time, then we can give hepatitis B according to this schedule like 0, 1 month and 6 months, 0, 1, 6. Similarly, IPV, the dose schedule would be 0, 2 and 6, 0, 2 months and 6 months. Similarly, PCV, pneumococcal conjugate vaccine, if somebody has not taken this immunization as per age, as per your NIS or IAP, the catch-up vaccination would be, if somebody is presented to you at before 6 months, then their schedule could be 3 plus 1, 3 doses, 1 month apart, with 1 booster at 15 months. Similarly, if somebody is coming between 6 months to 12 months, then the doses, catch-up vaccination doses are 2 plus 1. 2 doses, 1 month apart and 1 booster. Similarly, 1 to 2 years, if one baby is coming, then schedule is 1 plus 1. Similarly, if somebody is coming between 2 to 5 years, then the vaccinations, catch-up vaccinations will be different for PCV13 and PCV10. PCV13 is single dose is sufficient. But if you are giving PCV10, then 2 doses within a gap of 8 weeks has to be given. So this is something about your catch-up vaccination. Most common cause of AG in less than 5-year children. The answer is rotavirus. And the question may be asked, which is the second most common cause of AG? The answer is norovirus. Treatment, we know zinc and ORS and zinc. Zinc is the wonder molecule. This we have to remember. The dose is 20 mg per kg, 20 mg per day. It's not kg, 20 mg per day for 14 days for 6 months to 5 years. 5 years. If the child is less than 6 months, 2 months to 6 months, the dose would be 10 kg, 10 mg per day. 10 mg per day. Indication of antibiotic, somebody may ask, what are the indication of antibiotic in less than, in a case of AG in less than 5 years? The indication would be your dysentery. If it is cholera, if it is some child, then antibiotic can be given in a case of AG. Next, name this syndrome. What we are getting in this child? You are getting edema of the hand, pedal edema. Then what could the syndrome? The answer is this is a case of Turner syndrome. Turner syndrome, karyotype wise, it is 45X0. 45X0. Single X is of maternal origin in 80% cases. Short stature, your waving of neck, your low posterior hairline, your broad chest, cubitus valgus deformity. These are the classical features. We can get congenital heart disease. Most common congenital heart disease is bicuspid aortic valve, but clinically manifestation wise, most common is your coarctation of aorta. We can get horseshoe-shaped kidney, and primary amenorrhea could be the most common presenting feature. If you go do a ultrasound, we can get strict gonads. Next, Phase syndrome, PHSC syndrome. P stands for what? P stands for posterior fossa malformation. Then we can just recall P for posterior fossa malformation, S for hemangioma, A for arterial anomaly, C for coarctation of aorta, E for eye abnormality. So PHSC you can get. Sometimes it is Fess's syndrome, PHSCES, where the A stands for sternal clefting. Next, calorie value of drip milk. What do you mean by drip milk? Suppose it's one baby is taking the breast milk from one breast, then the milk that secreted from the other breast is known as drip milk. The question is, what is the calorie value of drip milk? As you know, milk, your breast milk calorie value is 67 kilocalorie. Then what is the calorie value of drip milk? The calorie value is 45 kilocalorie per 100 ml. Human breast milk calorie value 67 kilocalorie per 100 ml. Something about foremilk and hindmilk. Foremilk, the first part is rich in protein, sugar, and it satisfies the thirst. But hindmilk, it is rich in fat and it satisfies the hunger. This we have to remember. Next, a child can develop which form of anemia if takes goat milk for years together? We can get this question. Goat milk, if somebody is taking goat milk for years together, what will happen? If somebody is taking cow's milk for years together, then what will happen? If somebody is taking goat milk, the disease would be the child may develop megaloblastic anemia. Similarly, if child is taking cow milk for months together, then disease would be iron deficiency anemia. Next, connectors baby will develop which variety of CP? The answer is chorioathleted type of CP. Suppose a preterm baby, then the type of CP, preterm baby. Next question is, preterm baby can develop which variety of CP in long run? Preterm baby, the type of CP is your spastic diplegia. Spastic diplegia, preterm baby. If a connectors baby who has undergone excess transmission during the neonatal period, the chance of CP the child may develop is your chorioathleted CP. What should the value of MUAC or mid upper arm circumference to stump SAM? This is less than 11.5 centimeter. Then criteria, WHO criteria for SAM, weight for height less than 3 standard deviation, visible severe wasting, presence of bipetal edema, and MUAC less than 11.5 centimeter. Name the syndrome. This is the classical picture. We know this syndrome is Down syndrome. This is otherwise known as your trisomy 21. The most common pathogenic mechanism, your meiotic non-disjunction. Clinical feature wise, we can get obstinate eyes, epicanthic throat, flat occiput, protruded tongue, clino and brachydactyly. Congenital heart disease, most common congenital heart disease associated with Down syndrome is your endocardial cushion defect. And we can get duodenal anesthesia. Many clinical features are there. Just to remember, picture wise, we can get this is a case of Down syndrome. Next, which anemia is known as Cooley anemia? Cooley's anemia. This is thalassemia major. This is also known as your Mediterranean anemia. This is the quantitative defect in beta or alpha chain. Quantitative defect. Qualitative defect is your sickle cell, where your 6th position amino acid, your valine replaces your glutamic acid. But this is the quantitative defect. Either beta chain is defective or the alpha chain is defective. We can see the typical chipmunk faces, the typical depressed nasal bridge, and the pallor. This is your malocclusion of teeth. This is the classical chipmunk faces. What we will get in a case of thalassemia major. What is Evans syndrome? Evans syndrome is your ITB plus autoimmune hemolytic anemia. ITB plus autoimmune hemolytic anemia. This is called as Evans syndrome. Next, antenatal intake of lithium leads to which defect in a newborn baby? It's a teratogenic molecule. So what defect do you expect in a newborn baby if mother has taken lithium during the antenatal period? The answer is Epstein anomaly. There's something about other molecules. If mother has taken penicillamine, then you can expect cutis laxa syndrome in a newborn. Suppose the mother has taken high dose of vitamin D, we can expect supravalvular aortic stenosis in a newborn baby. Suppose statin if mother has taken, then there could be a possibility of bacterial anomaly in a baby. Carbimazole is classically associated with your aplasia cutis. Misoprostol, then chance that you can get Mobius syndrome or equinovarus deformity in a newborn baby. Similarly, stilbestrone DS, if mother has taken, then there could be chance of vaginal adenocarcinoma in adolescence. These are the important things we have to remember. We can get one MCQ in our exam. Next, which vitamin is known as vitamin H? It is biotin. Biotin is otherwise known as vitamin H. Deficiency causes hyperasthesia, hallucination. That is known as, and also it can cause dermatitis. Similarly, other things, pantothenic acid is referred to as vitamin B5. Vitamin B5 is your pantothenic acid. Similarly, vitamin H is your biotin. Essential fatty acid is used to be termed as queen of vitamins. Queen of vitamins. Some interesting one-liners you can remember. Queen of vitamins is your essential fatty acid. Similarly, essential fatty acid also designated as vitamin F. Vitamin F, essential fatty acid. Vitamin H, biotin. Your vitamin B5, your pantothenic acid. Next, most specific is CNS malformation seen in a baby born to a diabetic mother. As you know, many malformation you can get in a newborn baby born to a diabetic mother, but most specific CNS malformation which you can get one MCQ is your caudal regression syndrome. Most specific is the caudal regression syndrome. You can get macrosomia, you can get a metabolic abnormality like hypoglycemia, hypocalcemia, hypomagnesemia, we can get a polycythemia, we can get a RDS respiratory distress syndrome, we can get a VST, you can get small left colon syndrome, many clinical features we can expect in a newborn baby born to a diabetic mother. But CNS wise, most specific malformation is your caudal regression syndrome. Next, which strain is used in measles vaccine? It is Edmonton Zagreb strain. Like about measles, you can get measles solo or MR or MMR. This you can get a lyophilized form. The dose is at 9 months, 15 months, and 5 years we are giving subcutaneously, and 0.5 cc is the dose. The scoring system mostly used to assess respiratory distress in a preterm baby with RDS is your Silverman-Anderson scoring. Silverman-Anderson scoring is used to assess the respiratory distress in a preterm baby. What are the criteria? What are the features? Upper chest retraction, lower chest retraction, xiphoid retraction, nasal dilatation, and grunting. This is scored as 0, 1, or 2. If the score is more than 6, it is indicative of impending respiratory failure. Similarly, Downey scoring, another scoring is your Downey scoring used for respiratory distress. What are the criteria? Respiratory rate, cyanosis, air entry, grunting, and retraction. You can remember like cigarette, cyanosis, grunting, air entry, respiratory rate, and retraction. Criteria wise, mild, moderate, and severe. 0 to 3 mild, moderate is 4 to 6. If 7 to 10, then there is severe respiratory distress. Score of more than 6 is indicative of impending respiratory failure. Next, parahemophilia is due to deficiency of which factor? As you know, hemophilia is due to factor 8 deficiency. Similarly, hemophilia A, factor 8, it is by mistake written factor 10. Hemophilia A is factor 8, B is factor 9. Your hemophilia C is your factor 11. Para means pants. Similar, easy to remember, para means pants. Parahemophilia is due to deficiency of factor 5. Pseudohemophilia is due to, which one is known as pseudohemophilia? It is volume factor type 2N. The one classical subtype is 2N. This is known as pseudohemophilia. This is due to defect in the ability of the volume factor to bind to the factor 8. So there will be this is called as pseudohemophilia. Type 2N variety of volume factor deficiency. Next, what do you mean by internal hydrocephalus? Internal hydrocephalus and external hydrocephalus. Your non-communicating hydrocephalus is also known as your internal hydrocephalus or obstructive hydrocephalus. Also called as obstructive hydrocephalus. Communicating hydrocephalus is also known as external hydrocephalus because the pathology lies in the subarachnoid granulation outside the four ventricles, so that is known as your external hydrocephalus. Another term is your hydrocephalus ex vacui. It is due to the compensated dilatation of the cerebral ventricles because of cerebral atrophy. Next, which variety of neurofibromatosis is called as peripheral neurofibromatosis? It is type 1. Type 1 is your peripheral neurofibromatosis. Type 2 is your central neurofibromatosis. By type 1 neurofibromatosis, it is also called as von Recklinghausen disease. It is linked to chromosome number. NF1 is linked to chromosome number 17 and NF2 is linked to is chromosome number 1022. How to remember? Neurofiber matrix total number of letters is 17. So it is linked to chromosome number 17, characterized by 6 or more capillate spots, axillary fleckling, 2 or more neurofibroma, optic glioma, 2 or more least nodule, sphenoid dysplasia. Either two of the 6 should be there to tell this is a case of neurofibromatosis. Next, which variant of rickets is associated with alopecia and ectodermal defect? Answer is, it is vitamin D dependent rickets type 2. Vitamin D dependent rickets type 2 is associated with alopecia and ectodermal dysplasia, ectodermal defect. It is type 1 is autosomal recessive. It is due to mutation in the gene of renal 1-alpha hydroxylase. 1-alpha hydroxylase mutation is responsible for your formation of type 1 variety of vitamin D dependent rickets. The presentation, first 2 years of life. What are the biochemical findings? 25 hydroxy D3 normal, 125 decreased, parathyroid is increased, phosphorus decreased, calcium is decreased, and you will get metabolism. The only form of rickets with hypocalcemia is your type 1 type of vitamin D dependent rickets. Vitamin D, this is the form of synthesis. As we know, liver, your 25 hydroxylase, then kidney, your 1-alpha hydroxylase, and peripheral axon, that is responsible for your calcium phosphorus metabolism. Vitamin D dependent rickets is because of your deficiency or mutation at the 1-alpha hydroxylase level. Vitamin D dependent rickets type 2 because of the resistance to the action of vitamin D. Figure 8 or snowman appearance in X-ray seen in which variety of congenital heart disease? It is just like this picture. In which variety of congenital heart disease you will see all this type of picture? The answer is your TAPVC. Next, identify the ECG. What we are getting in this ECG? Inverted tick appearance. This is due to your dejection effect. Your dejection effect, what we are getting? Reverse tick ST segment or scooped ST segment we are getting in a case of dejection toxicity. So this inverted tick structure we are expecting in a case of dejection toxicity. These are the dejection toxicity, some side effects: TO wave inversion, sinus bradycardia, paroxysmal arterial tachycardia, arterial flutter, fibrillation, even bundle branch block also we can get in digital toxicity. Thank you. Please like this video, subscribe to my channel and share this video. Thank you.